Oh, today we have to discuss the do's and don'ts of hypertension, as I have heard. I think this is a very relevant issue. Hypertension is a very common disease, but very easily can be diagnosed. Still, in India, around one-fourth to one-third of the adult people are suffering from hypertension. That's a huge problem for our country, as because most of the patient are essential hypertension that starts even from the age of 25 to 40 or 50. So that's the main age group for earning people. So there is a huge workday loss due to this disease, but not only for the hypertension itself. The main problem of hypertension is its target organ damage. So that's the problem. The people suffering from hypertension may have heart disease, increased incidence of heart disease due to hypertension, as because hypertension is the leading cause of cardiovascular disorder, as well as is a linear relationship of hypertension with cerebral stroke, ischemic stroke mostly, or even cerebral hemorrhage. And there may be kidney disorder, there may be peripheral arterial disease, so on and so forth. So this is the disease which can be diagnosed very easily, but still so many people are suffering, and ironically almost 50% they do not know that they are having hypertension. That's the problem. So we'll have to have more radical assessment, more extensive research for finding out the patient in community who are suffering from hypertension. So we'll have to identify first those people or people at risk for developing hypertension. So we'll have to find out some ways, but I think most of these the things have been already delineated, have been practicing in so many areas, but still 50% of the people who are even diagnosed as hypertension is not under well controlled, and the uncontrolled hypertensive patients are dying prematurely. There's a problem for not only for our country, but almost all the countries in the world. They are having this problem, even in developed countries as well as developing countries also. So what we will do to prevent hypertensive disorder or even the risk of hypertension and its target organ damage prevention? We have found out that almost 95% of the hypertensive patients, they are having essential hypertension, or they are having hypertension due to complex interplay between our genetic and environmental factors. That's the problem. The secondary hypertension due to long-term use of different some of the medicines and some of the diseases which can give rise to hypertension, those are only within 5% of the total population of hypertension. The most of the patient of hypertension, they are having this hypertension due to their interplay of genetic factors as well as environmental factors. By the meaning of environmental factors, they mean the different attitude they are developing, this lifestyle they are developing, which is causing their problem. So we'll have to find out, and we have seen the obesity is a huge factor for association of hypertension. If we can reduce our weight, we can maintain our weight, ideal weight. There is, even if he or she is hypertensive, the blood pressure will be reduced to a range of, even if one can reduce only 10% of his or her body weight, the pressure will be lowered by 5 to 20 millimeters of mercury. That's a huge thing. If we can manage only to maintain our people into their corrected weight or advised weight, or maintain in the stipulated BMI range, that is from 18.5 to 23 for our countries. So there is a diet pattern also have been initiated for so many years. There's a DASH diet, or dietary advice to stop hypertension, which contains more vegetables and fruits, more potassium and less sodium and less fat, total fat as well as saturated fat, etc. So that diet gives rise to a lowering of blood pressure even by 8 to 15 millimeters of mercury. And there are other things the reduction in salt intake, but that doesn't help all people of hypertension. But there is a group of people, salt sensitive hypertension, they will be definitely benefited by reducing their salt intake to less than 6 grams sodium chloride per day. Then definitely physical exercise. Exercise has got not an uniform effect on hypertension. It is seen that for reduction of hypertension or making the blood pressure, lowering of the blood pressure, that depends on mild exercise, not very gym or other instruments. It's not necessary. Only brisk walking or a little freehand exercise daily, that can reduce blood pressure by 4 to 8 millimeter of mercury. Reduction of salt that also gives rise to 5 to 10 millimeter of mercury, and moderation of alcohol. But that was the previous advice. Nowadays it is said that it will be better if you can quit smoking as well as alcohol. That will be definitely a benefit for all our health problems. These are our advices for maintaining blood pressure. And so main advice is lifestyle modification. Maintain your weight, correct weight, have a regular physical exercise, freehand exercise, or control your diet. Mostly increase your portion of the diet with fruits and vegetables and less fat and carbohydrates, and have definitely treat vigorously for obesity who are having sleep apnea syndrome. Sleep apnea itself gives rise to more incidence of hypertension or accelerated hypertension. And take less sodium chloride, but there is a difference of opinion regarding how much salt to be taken by all the people. So there are differences in our medical community itself. But reduction of the salt, common salt, less than 6 grams per day will be a better advice. And alcohol, moderation of alcohol, better to stopping it. And smoking have to be quitted. So this thing, lifestyle modification, if we can practice from our school days, it will be definitely effective. It will see its effect in the future life. After that, developing hypertension, definitely, even if due to genetic factors or due to complex of factors, one develops hypertension, it is always better to consult his or her doctor regularly to maintain the blood pressure within range, so that he or she will have less target organ damage like cardiovascular disease or cerebrovascular disease, etc., etc. As because we have seen, even if the patients are diagnosed as hypertension, less than 50% are under well control. So there is a regular medical checkup, regular advice which will help to maintain blood pressure under control.